going to do it. So we may be joined in a few minutes as people come from wherever they are. So sorry about that, Rachel. There isn't as many as I was hoping.
It's okay. It's like a boutique salon. It's fine.
Okay. So I'm actually going to start by welcoming everybody. Thank you for coming. And because we're in so many varied places, I just read something today about acknowledging the territory and where does the territory of the land where we are. And for this one, we are on so many different places, and it's amazing because there are Indigenous people everywhere, and we should always be cognizant of that, that we have places that were ceded, places that are unceded, and we should be sharing this, not making ourselves the masters of the other people and allowing them to be our partners. So thank you for joining us. So I am going to introduce our speaker. So Rachel Cairns is a Toronto-based, I thought it was Vancouver, and I think she was at one time, but she's Toronto-based now, actor, writer, creator of Aborsh, and we're going to be talking about Aborsh, which is a podcast about abortion in Canada, which received a Planned Parenthood Choice Award for excellence in promoting sexual awareness for sexual and reproductive health. Her writing has been published by the Toronto Star, She Does the City, and Rabble. So in order to do this, I'm going to, I was going to ask Angie to say a few words, but Angie, you're out of it already. Sorry, I'm going to keep going. I would like to play something, and then I will ask Rachel her first question. So let's see if I can do this. Oh, I can tell I've had kids. I can't keep my mind going now. Where are we? Sorry. Oh my goodness. I wanted to. That's why I can't do it. So let me go in. My apologies. I should have had this ready to go. And here it is. Okay. Can everybody see this?
Yeah.
Norma, is it playing sound for you? Because you might not be sharing sound.
Oh, it's not sharing sound.
Yeah, Zoom.
Is it not? It doesn't share the sound?
Not for me. Can anyone else hear it?
No. Yeah, I can't hear it either. I didn't know whether I was supposed to push the button or not.
Oh, shoot. Okay.
I think there's a thing you have to, on one of the bars, you have to do something to let it do sound.
When you hit the share, Norma, you're up, and on the bottom left, you're going to see a little box that says share sound, and you want to make sure that's checked off.
So let me see when I do the share, when I hit the share.
Yeah, so you know how it shows
share sound. Oh, look at that. Okay, let's try this again. This is what we're going to learn.
In Canada.
Okay, I'm going to
In each episode of Aborsh, I share a bit about
my... We learn something on these meetings, and that's the first thing we've learned today.
No, we learned something. Can I get it back to the beginning?
Probably.
Oh, go back. It's not. Okay, there we go.
If you're someone who's had an abortion, or know someone who's had an abortion, or has ever just thought, hey, what's the deal with abortion? You might like Aborsh, a podcast about abortion in Canada. My name is Rachel Cairns, and I, like 1 in 3 people with uteruses, have had an abortion. It's a topic that has obviously hit our headlines once again with the garbage fire that's blazing in the United States, but we also need to be talking about abortion here in Canada. In each episode of Aborsh, I share a bit about my personal abortion story, and I also speak with experts and activists about why abortion is still such a big deal, what choice really means and looks like, and why that answer is different for different people. We tackle questions and conversations like, why don't doctors have to learn about abortion? What's up with all these young women in the pro-life movement? What exactly is reproductive justice? Who is Henry Morgentaler? What does it cost to become a parent? And can abortion be better? Yes, definitely. It should be way better when we talk about it on the podcast. So if you've had an abortion like me, or if you don't know anything about abortion, if you're horrified by what's happening in the States, if you never want to see that happen here in Canada, join me for Aborsh, an 8-part series coming to you every Monday starting June 13th. Subscribe on Spotify and Apple Podcasts or anywhere else you get your podcasts.
Here,
Woohoo!
gotta stop it. Hold on. There, she's gone.
Good.
For any of you who have not listened to any of the podcasts, please do. And now I'm going to put you a bit on the spot, Rachel. So Rachel did this in 2021-22. She did the podcast series. So she does know I'm going to ask her about why she started this podcast on this. She kind of told us a bit of there, but not the whole story. And I'm going to ask her to say whether she felt the podcast was successful and why she felt it was successful or not.
Mm-hmm. It was definitely successful in terms of my own metrics of, what that means to me. It had over 11,000 downloads. I'm a person with like 4 very intimate friends. So that's a lot bigger than that. And it got recognition from, advocates and activists within the Canadian landscape who I turn to research for the podcast, whose work I really admire and whose opinions I look to understand, what's happening in our world today and what progress should look like. So yeah, all those things considered, and I'd never made a podcast before. So all of that together, I'm going to make more of it too. So yes, I felt it was successful.
Okay, that's great. Thank you so much. So I know you have some slides to share.
Lots of slides.
Yeah, so we named this webinar Advocate for Yourself. And yeah, and I know that one of the first things that you thought you might talk about is how reproductive choices and rights are intertwined with women and pregnant people's. I like the word people's professional lives. You didn't use pregnant women. So explain that.
I always do use women, actually. Maybe not like strictly, but I use women and gender diverse or non-binary and trans, gender expansive, pregnant people, just because I like the ethic of inclusion. And even though whatever your gender identity is, the issues of privilege and oppression are going to affect you perhaps like the same over a macro umbrella, but on individual levels differently. So I don't always just say pregnant people, but I also don't just say women, because not all women can get pregnant and not all pregnant people are women. So I try to just cite everyone I'm speaking about and to when I can.
Great. Did you want to maybe start talking about what slides you have and carry us?
Yeah, I can dive into, so I've prepared a presentation. In an ideal world, it would be super interactive and more conversational, but it's kind of hard to do that without having met you folks before. So I will embark upon what I've prepared. And if anything comes to mind and you want to ask any questions or whatever, please feel free to interject and I can roll with that. And obviously at the end, we can discuss further. But yeah, this is kind of what I've created for today. So again, My name's Rachel Cairns. My pronouns are she and her. And as Norma introduced me, I'm the creator of this podcast, Aborsh. And I've prepared this presentation.
Sorry, Rachel. We see your notes and we don't see the slides.
Oh dear. Thank you for doing that. Let me try this again.
This is great. We're having a real learning session on this one.
Can you see the slides now?
Yes, we see your slides. It's great. Perfect.
Success. Great. As I was saying, I've prepared this presentation, basically on what I've learned throughout the process of making the podcast, as well as some reflections on advocacy and action when it comes to abortion and feminist issues more broadly. And I'm zooming in today from Toronto, which is Treaty 13 territory and the traditional land of the Anishinaabe, the Mississaugas of the Credit First Nation, the Haudenosaunee, and the Huron-Wendat. And I like to frame conversations that I have about abortion by calling upon the concept of reproductive justice, which is, as I'm sure you're aware, a framework and a movement developed and mobilized by women of color that acknowledges the limitations of choice for women and people whose experiences of sexism is compounded by racism, homophobia, ableism, classism, and colonization. And the fundamental tenets of reproductive justice are the right not to have children, the right to have children, and to parent our families in healthy and safe environments. And in the Canadian context, choice, particularly for Indigenous women and communities, has often meant the ability just to have and keep their children. And not only that, but to be able to raise them free of fear of state intervention and political, social, and environmental violence. And sometimes I feel like access to abortion kind of crowds out some of the other complexities of what's really required to have genuine bodily autonomy and equality. Abortion is really just one component of reproductive freedom. So I'd just like to kind of acknowledge that and invite you to keep that in mind as we embark upon these next slides together. And the issues that this presentation is going to touch on today. So I've created it in 5 parts based on your organization's foundational principles. So, let's move you up here so I can do that. Sweet. Okay. So I'll start with just part 1, an intro, just a bit more context about how I became an abortion and reproductive justice geek. Then I'll share what I've learned through making the podcast about abortion in Canada. We'll talk about advocacy through the lens of self-care, as well as collaborative advocacy in the form of community care. And then finally, the leadership required of us to protect and progress feminist victories and reproductive justice. So I had an abortion in 2019. And there were kind of 3 major components of my experience that made me want to learn and talk about it more. The first was access. It took me 10 days from the day I discovered I was pregnant to be able to access the care I needed. And there were some hiccups along the way that definitely weren't insurmountable, but it certainly wasn't a straightforward process. And I was really aware that for someone who was younger or who didn't speak English fluently or who didn't have a supportive family or experience navigating our healthcare system, it could be significantly more tricky. The second kind of aha moment about the experience was while I was waiting to get my abortion, I learned about my mom's abortion experiences for the first time. And she had had 2 abortions in the 70s. And when I asked her why she had never told me about them, she told me because the first one was illegal and the second one was horrible. Her first abortion was in 1970, which was technically the year after it had been legalized in Canada, but she couldn't find a doctor who would give her one. So she had to find a pre-med student who gave her a quinine injection. And then her second abortion was in 1978, but she essentially had to threaten to commit suicide for the Therapeutic Abortion Committee to approve the procedure. And it just really blew my mind how different our experiences of choice were, just like a generation apart. And the other kind of third major theme that triggered my imagination wasn't necessarily the abortion itself, but it was the circumstances in my life that informed my choice and in some ways dictated it, and my feelings about all of those things. I'm someone who wants to have children, so deciding not to go through with a pregnancy in my 30s really crystallized the difficulties in my life and brought up a lot of anxieties about money, frustrations with my career, and even doubts with my, current relationship. And so for whatever reason, I dealt with all of these feelings by learning as much as I could about abortion, from what was happening in my body to what was happening in my country to what was happening around the world with reproductive rights. And I think learning and researching gave me some semblance of control amidst the parts of the experience that felt very much out of my control. And all of this is essentially how Aborsh came to be. As you heard, season 1 launched last June, 2 weeks before the US Supreme Court overturned Roe and Casey. And I share my abortion experience in the podcast, and I speak to experts and activists dissecting those 3 questions, like why is abortion still such a big deal? What does choice really mean and look like? And why is that answer different for different people? And in those 10 episodes, we cover a range of topics from economic justice, Indigenous midwifery, the parallels of autonomy and equality between reproductive and LGBTQ+ rights. But I'm going to summarize the key takeaways that are specific to abortion in Canada in the next few slides. So I've divided them into the good, the bad, and the ugly. The good is like how we're unique and what we're doing well. The bad is like, where we need to improve on the report card. And the ugly is the anti-choice movement and the rise of the far right, which sounds intense, but it's relevant. So I'm going to read this quote, which is from Dr. Martha Painter's recent book, Abortion to Abolition. And for those of you who may not know, Martha Painter is a registered nurse, abortion provider, and educator. And her work and research focuses on the intersection of reproductive health and the criminal justice system. And she opens her book by outlining the many ways Canada is uniquely progressive in how we handle abortion. So she writes, the state of abortion access in Canada is unlike anywhere in the world. The 1988 Morgentaler decision resulted in complete decriminalization. A person cannot be charged for having or providing an abortion for any reason at any gestational age. With few exceptions, medication and aspiration surgical abortion are funded by taxpayers, and patients do not pay for care out of pocket. Almost every primary care provider in the country, including family physicians and nurse practitioners, can prescribe medication abortion. And bubble zone laws or hospital policies in many cities protect patients from anti-choice protests at clinic entryways so people can access care without fear of physical harassment or violence. Importantly, these provisions reflect the unconditional support of a vast majority of people in Canada for the right to abortion. And I really recommend checking out this book if you have the time. It's essentially about prison abolition as like the movement that has the potential to have that vast societal transformation that's needed to truly realize reproductive justice. And it's told through a collection of infuriating and inspiring real life stories. It's very good. So that's the good stuff. Now we'll talk about the bad. I've pulled up this article from Passage. It was written in 2021, and it sums up the limitations and inequalities of abortion rights and access across Canada. Access, as you've probably heard, is kind of like a patchwork. It varies widely by province, as do gestational limits. Yes, you can technically terminate a pregnancy at any stage of gestation, but facilities vary in their capacity to perform different types of abortions, and particularly for abortions past 24 weeks. There are only a few locations where that kind of care is available, and there's really no good reason for that because it's the same procedure as handling a miscarriage. This article makes a really compelling comparison between Sweden and Canada. So the author points out that Sweden's healthcare system mirrors ours in that it's funded nationally, but it's managed regionally. And Sweden has a population of about 10 million people, and it has about 130 clinics and hospitals that provide an abortion care. In comparison, Canada's population is more than 3 times that of Sweden's, and you can fit Sweden into the geography of Canada about 22 times, and yet we have less than 200 clinics and hospitals that provide abortion services, which means many people have to travel long distances in order to access care, especially people who need abortion after 10 weeks of pregnancy when you can't just do it through abortion medication. And then, that obviously brings in additional private costs like transportation and accommodation and food and childcare and lost income if you have to take time off of work and all that stuff. Sweden also doesn't allow conscientious objection on the principle that abortion is a right and a core service to which access should not be delayed. And in Canada, conscientious objection can be used as a legal loophole that essentially prioritizes a physician's right to their beliefs over a patient's right to their fundamental human rights. Sweden also does a much better job of training medical professionals. Basically, abortion care is viewed as a core component to anyone who wants to become an OB-GYN, and also a midwife. I think for residents of obstetrics and gynecology, training in abortion care is mandatory, whereas in Canada, only 2 universities make it a mandatory rotation. Everywhere else, it's something that's optional, even though it's considered essential healthcare. And through the literature that I've read, I know Swedish students receive theoretical training and are offered clinical rotations in abortion care. And we really just are inconsistent and inadequate when it comes to our medical schools. According to the Abortion Rights Coalition of Canada, there was a 2004 survey of Canadian residency programs in obstetrics and gynecology, which found that while all programs provided elective opportunities to obtain training in abortion, students were receiving less than 1 hour of training throughout a 4-year curriculum. And first trimester surgical abortion techniques were discussed in only half of Canada's medical schools. And they repeated the survey again in 2016, but there was only a slight increase in reported discussion of first trimester abortion techniques. They also did a 2018 survey. They surveyed about 1,500 family medicine residents, and they found that about 79% of family medicine residents had never observed or assisted with an abortion during training. And only about a quarter of them understood that if they were not going to provide abortion care, they were obligated to provide what's called an effective referral, which is basically handing the patient off to somebody who will help them with the request for an abortion. The author of the passage article argues that the government needs to put pressure on medical schools to teach adequate and mandatory training. I definitely agree with that. We should be doing that. The article also is making the case for a guaranteed right to abortion. That's a bit more of a complicated conversation. The author concludes the article with Canada's assumption has long been that abortion doesn't need to be legislated and regulated. The right to non-interference is enough, but decades of incremental progress and limitations have taught us that it's not, which is true. Access has been a pretty chronic issue since 1988, the decriminalization. However, advocates adamantly don't want to see an enshrined right to abortion for several reasons, which are outlined in this infographic by Action Canada. And they're a leading organization working to uphold and advocate for sexual health and reproductive rights nationally and internationally. So here's kind of like the main reasons. The first is that an abortion law could be challenged and overturned in the future, like we saw with Roe. In some ways, creating a legal framework gives anti-choice politicians and people just an opportunity to chip away at something. So they could do that by restricting who can get and provide abortions, or the reason why you can get an abortion. Also, advocates argue that we don't need a law because the Canadian Charter of Rights and Freedoms does protect the right to abortion, as the history of our case law demonstrates, with Supreme Court cases like R.V. Morgentaler, which of course decriminalized abortion, and cases like Tremblay v. Daigle and Dobson v. Dobson, which were more to do about fetal rights. Canadians also have a right to healthcare guaranteed by the Canada Health Act. And advocates say that instead of putting energy into a law, we should really be putting energy into having our governments do a better job of strengthening, upholding, and enforcing the Canada Health Act. Instead of a law, advocates would rather see the government create the promised Health Canada web portal that will feature accurate, unbiased information. And not only would this be a helpful resource in terms of consolidating public education, but it would also be a really meaningful gesture towards political destigmatization. Advocates also want to see a government increase federal health transfers with ties that are explicit about the expansion of reproductive and sexual health services. And they want the government to permanently resource Health Canada's new Sexual and Reproductive Health Fund. So this leaves us with the ugly. May
I, Rachel, just to let you know, we did, and I'm going to send the speakers later on. Colleen's got them. We did a resolution, and we did ask for some of those things in our resolution. Excellent. Asking the government. So
thank you for doing that.
We'll share them with you.
That's so good. I'm really glad. So yeah, as we know, the fall of Roe is a pretty significant domino in the escalating global attack on reproductive rights, which is occurring in tandem with the rise of far-right politics. And Canada is definitely not exempt from the infiltration of extremism. Right-wing politicians are calling for the privatization of healthcare. We've seen an increase in sexist and racially motivated hate crimes, and the occupation of our nation's capital by the so-called Freedom Convoy early in 2022 really exposed how far-right groups are becoming increasingly mobilized and internationally organized. After the overturning of Roe, Poilievre tweeted that his government would not introduce or pass any laws restricting abortion, and is claimed to be pro-choice, although his voting record proves otherwise, as it does for 69% of Conservative members of Parliament, as you can see here in this graph. Moreover, after he was officially elected the leader of the opposition, it was discovered that Poilievre's YouTube videos had embedded hashtags used by a male supremacist movement that believes society has been corrupted by feminism. So as anti-abortion populist movements successfully reverse reproductive rights in the US and in European countries like Turkey and Poland, the international community really has to combat these regressive campaigns with solidarity. And we can do that through advocacy. So fun fact, etymologically speaking, advocacy comes from the Latin root advocare and literally means to call out for support. And first, I'm going to talk about advocacy on an individual level and specifically in the context of healthcare before zooming out to a more macro level. This is an excellent article recently published in Chatelaine about how to be your own best advocate in the healthcare system. And basically she constructs it into kind of like things to do before your appointment, things to do in your appointment, what do you do after your appointment? But the author also frames that first by acknowledging the research and the trust gap. So I'm sure you're aware, but just to refresh our drinks, the research gap refers to the fact that women have largely been and continue to be excluded and underrepresented in medical research and clinical trials. And the lack of sex disaggregated data means that women are more likely to be misdiagnosed, ineffectively treated, and have worse health outcomes than men. And on top of that, Canada also has a lack of disaggregated race-based data. And in 2019, there was a first of its kind paper out of the University of Toronto explaining how this endangers particularly Black Canadian women who may be underscreened for cervical and breast cancer. So off the bat, this overrepresentation of the male body as the human body and color blindness puts women, particularly women of color and gender diverse people, at an extreme disadvantage within the healthcare system. And the trust gap refers to the dismissal of female and gender diverse pain and how women, ethnic minorities, people with disabilities, and individuals who identify as LGBTQ+ are far more likely to distrust their healthcare providers, and for good reason. The medical profession has a long track record of historical biases and abuses of power. There's a real lack of representation within the Canadian healthcare system. You know, for the most part, care providers don't reflect the diversity of the Canadian population. And these disparities, they do cost lives. People who feel that their providers do not listen to them or that they are unwelcome or judged don't trust the system and are less likely to receive preventative care and seek treatment for chronic illness. So that's why it's really important to learn how to take care of yourself the best you can within the system. So the first piece of actionable advice is to just prepare for your appointment kind of like you would for an interview. Track your, I mean, you've probably heard all of this before, but it's nice to consolidate and just remind ourselves, track your symptoms, their frequency, their qualities, how you manage them, what works, what doesn't, current medications, allergies, family histories. And, you know, you can keep track in an actual journal. And there's also really good free apps that you can use that kind of like formulate your data into really beautiful graphs that can help you look at patterns. So these are some of them: Simple, Flare Down, Wave Health. She also says, you know, she encourages you to do your own research from reputable sources, but just to be conscious of medical misinformation online. Once you're in the office, go in with a goal in mind so that you can help focus the appointment and articulate what you're hoping to get from your care provider. This one can be kind of hard, but give feedback. If you're feeling rushed or uncomfortable or not heard, try to say that and acknowledge that. Another way to help with that is by bringing a support person to your appointment. There's a really growing body of evidence that patients have way better health outcomes when they aren't alone on their healthcare journey. And someone being in the appointment with you can provide comfort and ask questions and take notes if you're feeling overwhelmed or are in pain. So yeah, if you have that option available, ask for some support. And at the end of the appointment, ask about what the next steps are, whether that's a next appointment or a referral or a type of treatment or a test. And when you get exceptional and good care, if you have the time, say thank you, even if it's just like writing a note. But it's just a nice thing to do. And doctors and the healthcare system, at least all the ones that I know, seem to be under incredible strain right now. And I think when they have moments of people valuing the care that they give, that's meaningful for them and helps keep them going. And like, reward yourself. If it's an appointment that's giving you anxiety or discomfort heading towards, have something to look forward afterwards. Get an ice cream, do something nice. You did it. And then the kind of final part is, whoops, that looks like it's out of order. Beep, 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 beep. There we go. The final part is sharing knowledge and experience. So in the article, she's asking a care advocate for, why people should connect with others about, their healthcare experience. And the advocate says, there's a large body of research that shows connecting with people who are going through similar health experiences can help you manage chronic conditions, cope with stress, and even prevent some diseases. It can also give you insight into how to advocate for yourself. And this is really the spirit with which I wanted to share my abortion story and also connect with other people about theirs. So often, and I feel like particularly with health issues and events in our lives, it can feel really difficult and isolating. But the reality is you're likely in very good company. For example, we know that 1 in 3 Canadians who can get pregnant will likely access abortion in their lifetime. There's really strength in numbers, which brings us to our next topic. So advocacy as community care and the role of the feminist movement in influencing political leadership. So, having enjoyed the ability of exercising my reproductive rights, I wanted to learn about the history of what it took to achieve them. Suffrage, equal pay, pensions, a minimum wage, maternity leave, sexual harassment legislation, and reproductive and LGBTQ+ rights. All of these are things that the feminist movement and its allies have fought for in the face of resistance. And the danger in not learning or forgetting these feminist victories is that it becomes easier to buy into the myth that times change and progressive politicians and benevolent business leaders just keep up and get on board. And that's generally really not the case. And when we forget the work that it took to hold power accountable, our ability to do so atrophies. So, I was born 3 months after the decriminalization of abortion, and a lot of people my age, unless they have feminist parents or have been exposed to gender studies, don't even know who Henry Morgentaler is. And I have seen that change a bit since the overturning of Roe last year, but I also think we should question why it's the reversal of reproductive rights that increases our awareness about them. In a 1977 interview, Henry Morgentaler, who was a Holocaust survivor, described himself as a martyr for a cause. He believed freedom of choice was an enlightened philosophy pitted against a totalitarian ideology. But Morgentaler didn't take on his multi-decade struggle alone. What I think often gets erased about Canada's history of reproductive rights is how the women's liberation movement was fundamental to this victory. Decriminalizing abortion in Canada required careful and coordinated coalition building encompassing multiple strategies supported by a broad base of diverse activists, political groups, and labor unions, really just people from all walks of life. I interviewed Judy Rebick and Carolyn Egan for the podcast, two activists who were a part of the group that convinced Morgentaler to open an illegal clinic in Toronto, and that was the clinic that instigated the lawsuit, which eventually led to the abortion law being struck down. And they felt that it was Morgentaler's job to challenge the law, and their job was to build the movement. So this is a pamphlet about the abortion caravan, which traveled across the country from Vancouver to Ottawa in 1970, protesting about the abortion law. And they did this the year after Morgentaler opened the country's first abortion clinic in Montreal. And the caravan really kicked off the Morgentaler era and the multi-decade struggle to decriminalize abortion. The women's liberation movement rallied public support from labor unions and workplaces, medical professionals, students, faith groups, and organizations from diverse causes and political orientations. Rebick described the strategy as a legal fight, an industry fight, and a lobbying fight. And they really had an intersectional approach and ethic. The Ontario Coalition of Abortion Clinics was the organization that worked with Morgentaler to establish his Toronto clinic. And for them, it wasn't just about a matter of access to abortion. They wanted to challenge a racist and class biased system because they were working with the communities who didn't have privileged access. They had a mission statement that defined reproductive freedom as a person's right to safe and effective birth control services in their own language and their own communities, decent jobs, paid parental leave, childcare, the right to live freely and openly regardless of their sexuality, and an end to forced, coerced sterilization, employment equity, and of course, full access to free abortion. They also had to work with people whose politics they didn't agree with. In our conversation, Rebek referred to a group they called the Rosedale Ladies, who they were very judgmental of and felt that they had very little in common with them. But they knew that the Rosedale Ladies were connected and raised a lot of money for the court case. So they had to put their differences aside and work with them. Rebek also was like, I debated in more churches than I care to remember, which is a line that always really made me laugh. And one that I would say it seemed like the key component of all these different strategies was getting the labor movement on board because of the political power that unions were able to pull. And the labor movement has always been a side to feminist action as a means to challenge power indirectly through the workplace, but they had to win them over. Union leadership felt that abortion wasn't a union issue. It was too divisive. They wanted to focus on affirmative action, but they went to union halls, they debated, they had union members share their abortion stories and stories about parenting and poverty, and they got the Ontario Federation of Labor on board. I remember Judy's advocacy along with Nancy Jackson. Definitely, Mina. Oh, thank you. And before I get into all the union stuff, again, like this is, I'm sure you know of Rise Up, which is this like digital Canadian feminist archive. And you can type in anything and it finds all of these wonderful, juicy gems in there for you, such as these rally posters. And in this one in particular, I just really thought like, look how many sponsors and endorsements they have, all of the like clubs that they had to talk to and network with. Like it just seems, I know people are still doing it, but in our digital age, it just feels like so grassroots and something that feels like a skill less of us have. So back to the labor union stuff. Basically, another reason why they felt the labor union strategy was so vital was because they had recently seen the landmark victory from the labor movement, which was in 1981 when the Canadian Union of Postal Workers won maternity leave, which was something that was fought for and won on picket lines and led by feminists working within and outside the feminist movement to build public support. So, like abortion, maternity leave and parental leave is another social value that feels distinctly Canadian, especially in comparison like to the States. And many people just expect to be able to access maternity leave, but it's really a relatively recent part of our social fabric. As I'm sure many of you will remember, but again, just for context, at the beginning of the 1960s, just over 30% of women aged 20 to 30 participated in the Canadian labor force. I know when my grandmother was pregnant, once you started to show, it was expected that you would just quit your job. And I think that ethic was still pretty prevalent in the 60s as well. But by the end of the 60s, the pill became widely available, setting women on a path to gaining economic power by entering the workforce in droves and, of course, entering unions. And by the end of the 1970s, women's participation in the workforce had doubled. And then in 1979, a coalition of Quebec public sector workers called the Common Front won 20 weeks of fully paid maternity leave, 10 weeks for parents who adopted a child, and 5 days of paternity leave. And this achievement inspired the Canadian Union of Postal Workers to make maternity leave their central demand when they went on strike 2 years later in 1981. At the time, they only got 6 months of leave without pay. And today we consider maternity leave and parental leave just a social good. But at the time, the strike was demonized and faced harsh opposition from their employer, the media, and the public. The president of the Canadian Federation of Independent Business, his name was John Bullock, criticized the government's position against back-to-work legislation, which was also won by the postal workers, and called for a ban on strikes by postal workers, saying that paid maternity leave is a totally ridiculous kind of demand to expect employers to pay. Those who want to have babies should just pay for them. But this backlash was largely because their opponents knew that if Canada Post agreed to paid maternity leave, then other public sector unions and even private sector would have to follow suit. So the CUPW, they expected this opposition, and they had a proactive, multifaceted strategy to build a broad-based coalition that would fortify support for the strike. So in the weeks leading up to the strike, they did an internal education campaign. They distributed literature that outlined their key demands, provided information about the Common Front parental leave victory, and also demonstrated the relatively low cost of maternity leave for the employer and the devastating loss of income for individuals and families. And they also built alliances within the women's movement, reaching out to hundreds of feminist organizations across Canada in weeks leading up to the strike. So they could have people join the picket lines, have their allies host rallies, write letters and editorials, phone into radio talk shows to discuss the importance of paid maternity leave and parental leave, and just help build public support. And this is an excerpt from a pamphlet that the National Action Committee on the Status of Women produced, encouraging Canadians to support the strike, and they held a press conference in Halifax and Toronto, and there was also a solidarity march in Vancouver. So the strike lasted 42 days and resulted in the first federal government negotiations that won paid maternity leave, which topped up new mothers to 17 weeks of leave at 93% of full wages. And other unions quickly followed suit, demanding paid maternity leave in their collective agreements. And essentially, the government was forced to institutionalize maternity leave by writing it into labor codes. So what started as a gain for public sector workers became a life support for all Canadian families who have insurable income. Parental leave in many ways is still insufficient. I personally don't get it. But so it needs to be further expanded. But in her book, Take Back the Fight, Organizing Feminism for the Digital Age, Nora Loretto writes, the fact that parental leave survived neoliberal state reform and is even being expanded is a testament to the work that activists did to popularize and normalize it. And I also really recommend checking out Loretto's book, because it's a critical analysis of the Canadian feminist movement, or the lack thereof in some instances, due to the difficulties of organizing in the digital age, which has allowed us to be more connected than ever, but has also made it harder to meaningfully unite and mobilize. As neoliberalism has infiltrated our politics and our economy, it's shifted our cultural focus to the individual instead of the collective. And as life gets more expensive, people have less time to volunteer and organize and be informed. And internet platforms often distort discussion to extremes because they profit on political polarization, hate, and misogyny. In her book, Loretto writes, under neoliberalism, the greatest enemies to power are organized groups of people. If the goal of neoliberalism was to break up collective consciousness to make people easier to control and oversee, then the antidote to neoliberalism is community. We know from feminist victories like winning maternity leave and reproductive rights that building a mass movement requires people coming together to fight for social change through some kind of structure, be that a workplace, a union, a student club, or an organization like the BPW. And that's why I think your organization is really important and unique within the Canadian context, because you're a body with a really long-standing history and intergenerational networks where relationships can be nurtured and knowledge and information can be exchanged. And you engage with the government to defend, maintain, and improve specific aspects of economic and gender equality, which is really vital work. And you know, there are people everywhere pushing progress forward. When we're talking just about abortion, there has been amazing advocacy, and particularly in the last decade. Thanks to that advocacy, in 2015, abortion was finally included in interprovincial billing agreements. Before that, if you got an abortion outside of your province, you had to pay for it. Advocates successfully got all of the provinces to pay for mifegymiso, the abortion pill, with Saskatchewan being the last one to sign on in 2019. The Maritimes have historically been really antagonistic to abortion access, but that's also been a catalyst for tremendous advocacy. PEI didn't have an abortion clinic until 2017. Now they have 2 points of access. Nova Scotia has a self-referral line. The New Brunswick Abortion Care Network is training more professionals to provide medication abortions and raising public awareness so people know where and how they can get abortions in New Brunswick. And even though we do have a patchwork of access, and there's still a lot of work we need to be done so that all Canadians can get timely care, in the last decade, access has improved exponentially. A 2012 University of British Columbia survey found that there was fewer than 300 physicians who provided abortion care across the country. And when they conducted the survey again in 2019, they had 465 physicians and nurse practitioners respond. And that growth was largely thanks to the introduction of medication abortion. And what I found particularly interesting about those findings is that 85% of the respondents in all specialties, so nurses, GPs, and OB-GYNs, were women. And respondents younger than 40 formed the largest age group, many of whom reported only providing abortions for less than 5 years. So that demonstrates that training is improving and the workforce is expanding. And it also reminds me of Morgentaler and maternity leave, because progress is being forged by women, helping women and people who can get pregnant. And it's an inspiring reminder that the change that is possible when our communities organize and unite. And the most recent change is BC finally getting us free contraception as of April 1st. Which is, you know, access to contraception is a recognized basic human right. But contraception has largely been a private cost in Canada, shouldered largely by women. Social scientists call this the feminization of responsibility, meaning that women pay for their contraception, they do the work of managing their fertility, even though they're fertile for about 24 hours a month and their partner is fertile 24 hours a day. And they also deal with the consequences of contraceptive failure and unplanned pregnancies. In a CBC article covering this victory, it's estimated that the initiative could save someone who spends $25 on the pill every month up to $10,000 over their lifetime. Free contraception also saves the healthcare system loads of money. Nearly 50% of Canadian pregnancies are unintended, says the Society of Obstetrics and Gynecologists of Canada. And that's crazy because it really is just proof that our sexual education is seriously lacking, as is access to reliable and affordable contraception. And a 2019 position paper by the Canadian Pediatric Society outlined that while universal contraception coverage would increase public spending by an estimated $157 million annually, this expense would be more than offset by the $320 million saved in direct medical costs related to unintended pregnancies. So I feel like we're at the beginning of the possibility of getting contraception covered coast to coast, which is a significant way the Canadian government can uphold and protect and expand access to reproductive rights and freedom. And we're the only country with universal healthcare that does not include drug coverage, and we have the second highest prescription drug prices per person in the world after the US. So if we get contraception covered, that could be a significant domino in the case to finally realizing pharmacare, because Canadians should be able to access the medication they need, not just the medication they can afford. At the moment, about 1 in 5 Canadians have inadequate or no drug coverage. Many of these people experience low wages and precarious employment, so it's the most vulnerable people who are the most acutely impacted. And when Canadians go without essential medication due to cost, similar to contraception, we end up putting more stress on the healthcare system, which costs us all more in the long run. So not only would it save the healthcare system, save individuals, it would also save employers. They could benefit by not having to include expensive drug plans and employee benefit packages, and would have more money to invest in higher wages or improving other benefits. So really, pharmacare is just, it's a win-win-win all around. Since BC included contraception in their budget, a motion has been tabled in Ontario. The NDP in Saskatchewan are pushing the provincial leadership to do so. The federal NDP, I know of a petition going around calling for it in the upcoming federal budget. Organizations like Wellness Within in Nova Scotia are urging their provincial government. So the pressure is on, and I think we should just all get on board and apply it. So to wrap up, I think, what we learn from feminist victories of the past and present is that meaningful progressive change requires constant and sustained pressure. Creating collective action is a marathon, but it's the only way to practice collective care. And when we do that, the power really is in our hands. So yeah, those are my thoughts.
That was awesome. That was awesome, Rachel.
You're welcome.
And Judy Ribbick, it was Nancy Jackman, not Nancy Jackson.
Okay.
Nancy Jackman and Mary Lou McPhedran, who's now a senator.
Amazing.
So she was also part
We've
of
actually had Mary Lou McPhedrick speak at our BPW online group.
Cool.
Years ago. Yeah.
That's awesome.
Are you in Toronto, Rachel?
I'm currently based in Toronto. I grew up in Vancouver and my parents live there. So I go back to that part of the woods pretty frequently, but I pay my taxes in Ontario.
Are you in, what part of Toronto are you in?
Right at Bloor and Spadina.
Okay, great. I'm going to see about getting you out to our